Should I take up radiology? Is it good enough for me? Is it worth to sacrifice my dream branch to take up radiology? Will I be earning enough? And most importantly, will AI take over my job? We'll be answering all these and much more. Hi, I'm Dr. Somlina. I'm a radiology resident and I try to make medically relevant videos. So first things first, your dream branch is your dream branch. Imagine yourself 5 years down the line. Would you like to see yourself as a radiologist performing ultrasounds, reporting CT MRI, maybe performing certain interventional procedures, and then whenever he or she wants to party, wants to holiday, they can take a leave? Or would you rather see yourself as a gynecologist or an internist or maybe a pulmonologist or surgeon seeing patients in the OPD clinics, treating them or operating on them, and never take a decision based on the following? Number one, never think while taking a PG seat that my 3 years of residency is going to be very hectic. I will not get time for partying. I will not get time for holidaying. Do not decide to become a radiologist because it is trendy or maybe because your favorite senior has taken radiology. And never take up radiology if you want yourself to be the popular doctor in your society and you crave for the respect that you get after treating or operating on a patient. The reason is simply because maybe the lifestyle of a radiologist seems to be lucrative, but you need to study a lot in radiology. A lot means a lot. You need to know everything from head to toe about every systematic pathology should be at your fingertips. And if you do not keep yourself updated to the latest academic advancements, your professional reputation will suffer. Not only that, a radiologist is able to earn more only if he decides to work a lot. If he decides to have a less hectic, a less busy lifestyle, he can do so, but he will earn less. See, it's not at all about what others think about me. Never take up radiology thinking that once you become a radiologist, you will seem to be the coolest person in your group. No, it does not work like that. You will be the best specialist in the specialty that you specialize in only if you're sincerely working towards it. So my advice would be never ever compromise on your dream branch to take up radiology. No, it's not worth it. Yes, there are certain students like me, myself, who were not so much sure about which subject to take, and they have mentally decided to adjust themselves to whatever subject they will be opting for. So for those people, I have some suggestions which you can think of while taking up radiology. Number one, you want an N branch. Number two, you want variety in your daily life. Three, you love reading new academic stuff. Number four, you do not want to take up your workplace tensions back home and you want to have a good night's sleep every day. Because here you can accommodate for your hobby because you can select the lifestyle you want to pursue. Also, if you like to be at a position where your report decides the further treatment protocol of the patient. Another very important pro, which I find, is in radiology, you get paid proportionately to the hard work that you do. This is important because in India, the government hospital doctors, they work relentlessly for hours at a stretch, some days even without having any meal, but still, in proportion to the sacrifices they have made for the work, they are not getting paid anywhere near to it. So in radiology, because you do not necessarily have to make all those sacrifices, hence I would say that the payment is proportionate. Also, you should take up radiology because there are very less radiologists in India in total. General doctors, they usually tend to have less knowledge about radiology. Even if they have, they are not allowed to practice. So the chances of a general practitioner or a quack taking up your job is less likely. AI replacing you, I don't see that happening anytime soon. For now, AI is just going to make our lives better in certain aspects, but still the accuracy of AI is questionable today. And also for those people who do not want to stop their studying, DM super specialization courses and fellowship courses have started in India. Right now, the seats are very less, very few, but hoping these numbers will rise up in the near future. So if you are a radiologist watching this, kindly comment the reason why you took up the subject. And if you are a NEET PG aspirant and want to take up radiology, mention in the comment why so. Thank you. Till then, bye-bye. Wait for my next video.